CIF, the COVID isolation facility in Barricada Heights.
Right. So, tragically, we've seen 4 COVID-related fatalities in the last 24 hours. We go now to the Port Authority of Guam, where they have lost a Port Strong brother, as a press release had come out from the authority yesterday that the 81st COVID-related fatality, who was, I believe, a 41-year-old man, was a port employee. And so we have GM Rory Respicio. Good morning, Rory, and our condolences to the Port Strong fam.
Yeah, good morning, Chris, Sabrina, and Jason. Henry St. Nicholas was a 49-year-old, 7-year Port Authority employee. And one of the first things that we did upon learning of his passing was to call his wife. And the first thing I asked his wife if I could have the authority to authorization to say that this is a COVID-related death. And she's, with tears holding back all the pain, she said, please express to everyone how real this coronavirus is. She's very sad that she couldn't be with her husband. She was very sad that he died alone. And these are some of the realities that these families are facing. And so as I made the announcement to all the Port Strong family, I was very clear to say that I'm doing this under her authorization, his wife's authorization, because we always want to respect the family's right to privacy. But in this case, she really wanted all of the port employees to know and the people of Guam to know to take this virus very seriously. We extended our condolence to Katrina. Henry has a brother working at the port. His name is Ray. And it's just, I think we're all shattered. I know we're all shattered, and I received a lot of phone calls from our port employees just expressing condolences. And one of the first things that we did yesterday also was I reached out to Teresa Ariola from the Guam Behavioral Health and Wellness, and I asked what kind of process can we set up for our employees and their families to receive counseling if needed. And she was very receptive, very supportive. As you know, the Joint Information Center always releases at the very end of their press release at any one needing counseling to please reach out. But in our case, like we've done with contact tracing and other efforts, we don't want to be a burden on public health, and we don't want to be a burden on Guam Behavioral Health. So we're going to channel all those counseling requests through our HR staff. And so our condolences go out to Henry's family. He has children, he has siblings. More importantly, he has a huge Port Strong family, all of whom continue to come to work despite the uncertainties that we all face down here. I just want to reach out to our coworkers too, and continue to thank them for just being strong, for coming to work, for recognizing that if they didn't do what we do, 90% of the goods coming to the island would not be on island, would not be distributed throughout the region. The supply chain is very critical. And I even told Katrina on the phone, I said, Henry was in our video promoting the COVID app. And then that's when she, her spirits were kind of lifted, and she said, yeah, I was even telling him, who do you think you are? You're a superstar now? So she had that brief moment, and I said, ma'am, your husband will forever be a superstar. He's a frontliner. He's a frontline hero. He's a COVID warrior, and we're going to revere him, and we're going to do everything we can to honor him. We've identified Ms. Francine Rojo from HR to be the family's point of contact to help process all the administrative stuff. She's already reached out to the retirement so that Katrina won't have to go to the retirement too. So those are the kind of things that we try to do for those of us who are down and out in whatever way or for whatever reason. And because of COVID and all these public health guidelines, we're going to try to do everything we can so that we could do this by email, or if we have to run the paperwork to his wife to sign, if we have to bring a notary to their house, we'll make all those extra efforts so that she could just focus on on the great loss that she and her family are facing.
Rory, what village was Henry from?
His family's from Sinahanya.
Okay. And he was hospitalized with COVID, right?
Yeah, he was in the hospital for quite some time. He was on a ventilator as well. And that's the other thing. Every single day, we reach out to either the port member who is COVID positive or a member of their family, so we get constant updates. So we saw his progression. We saw when he was put on a CPAP, and then we also learned when he had to be ventilated. And kudos to GMH. Lillian was still on, and we just have to respect the protocols that we have. And this whole notion of having to die alone, it's just unfathomable. And if we just take the necessary precautions, I was just watching the U.S. Surgeon General's message confirming everything that the island is doing and trying to do to flatten the curve. But there's no more important message than what Katrina said yesterday, that the virus is real, and that she doesn't want any family to go through what her family has gone through. So despite all of her loss and her pain, she's still wanting to make that clear so no one has to go through what they're going through.
Rory, does it frustrate you at all that, 9 months into this pandemic, 83 deaths, thousands upon thousands of COVID-19 positive cases later, that we're still sitting here this morning in November trying to convince people that this virus is real?
Yeah, and it's also very challenging here at the port. So what we try to do with our deputies, Dominic, Louis, and the whole management team and everybody at the port, we're trying to create a bubble at the port. And we have to operate under the CDC guidelines for critical infrastructure worker, which is a very different standard than public health because of the supply chain. So just some of the things, as we see our employees getting tested, we had almost 400 that got tested because they were identified as a close contact. They can't go home and wait for the results. They have to come back to work. But what we do when they come back to work is we make sure that they create a bubble for themselves, that they're not exposed to anybody as much as possible, up to 15 minutes collectively per day, that they still wear their masks, they wash their hands, they sanitize their hands as much as possible. So if in the event there's another identified positive, you see that our number of close contacts that we identify through contact tracing is very minimal, because we just don't have them go around and, at least for the next couple days until the test results come back, those are the extraordinary precautionary measures that we're taking. But I do see employees sometimes, their mask is under their nose, and I just call them out. I said, hey, put your mask on, put your mask up. And it doesn't take for me to walk around in the yard and to see, but for the most part, the port employees have been extremely compliant. I'm very grateful that they're compliant. I don't believe we have COVID fatigue here at the port. It is frustrating, Chris, as you've asked, but we're innovating. We're trying to reinvent ourselves. We're trying to be innovative. We're saying, okay, we know you can't wear the mask like I'm wearing because they're out in the yard, they sweat, and it gets hard to keep on. So we have the cloth mask. In addition to that, we also ordered the scarves where they just pull it over their nose because of the the kind of activity they have. So we're adjusting to their needs to make their lives as comfortable as possible, so they could take on all these precautionary measures. But I don't want to say it's frustrating because this is the new normal. And it's on top of port operations, which is challenging in and of itself. We're operating under this COVID-19 pandemic, and under this climate where we just have to keep reminding ourselves that we can't slip up. And that was Katrina's message that she wanted to convey to the port and to the community.
Rory, before
you never know, you never realize how sad and how hard this is until it hits close to home. And every time we have a COVID-19 positive here, I get the messages from the employees who tested positive. I tell them I can't say because of HIPAA regulations, but I also throw it back at them and say, well, what are you worried about? You don't have to worry if you kept your mask on, if you're not in the lounge. We're not doing those things here at the port. Then they're kind of reminded, oh yeah, you're right. Okay, so I'm gonna be okay. Well, you're gonna be okay if our contact tracing team didn't contact you. That means that you're not a close contact. And if you've been identified as a close contact, go get tested. And then if you're positive, we also have a group of employees here that give a care package, to which we're including a pulse oximeter. That was the Lieutenant Governor's recommendation, because as he was battling his own COVID-19 processes, he talked about that on your show, that without that pulse oximeter where he was monitoring his oxygen level. Yeah. So we're including that in all of our care packages that we give to our port employees that test positive.
Rory, before we let you go, the JIC releases, all we get are the numbers, 81, 82, 83. But like you said, Henry was a husband, he was a father, and to you, he is family. And so just so that we get an idea of just the type of person he was, if you could just share, I guess, a memory you have of him.
Well, Henry had a smile that can bring joy to anybody's life. And I'm also seeing our port employees posting on Facebook. They're posting pictures of him, gatherings that they had pre-COVID pandemic. We have an employee chat where the employees can write in their questions or comments or concerns. And as soon as Henry's announcement was made, so many port employees were writing in. A couple of them just very expressing just how much hurt that they're going through, because they worked with him, knowing his wife, his brother here worked at the port. Henry was just an amazing individual. And even his wife said, despite what he was going through with COVID, he loved the port. She said he loved coming to work every day. He loved being called Port Strong. He loved being recognized by the community as a Port Strong family member. So we have about 368 Henrys here at the port, now 367. And I just want to ask the port employees to just stay focused and just do whatever they've been doing to continue to have that will to come to work, because we all worry about going home and what we would do and how we would expose this to our families. But we're being guided by those CDC guidelines. We're following the governor's directives, the public health directives, and we will do, like I said, everything we can to honor Henry's memory. We're also, when the time is right, because Katrina said that they're waiting for some family members to come in, we want to ask her if we can have some kind of ceremony like Customs did here at the port. And so we could just say goodbye to him one last time.
Well, the condolences to you and the entire port family, and to Katrina.
Thank you. And thanks for giving me an opportunity to talk about Henry and remember his life, and to ask the people of Guam to always remember him and others, the COVID warriors, but more so in Henry's case, the frontline hero, as we've seen other frontline heroes succumb to COVID-19.
We have a comment here. Gene Uggan Martinez writes, "Good guy, always with a smile."
Always with a smile.
Thank you, Rory.
Okay, take care.
Appreciate your time. Be safe. And there's virtual chicken a la king. It's an old family recipe from Jason's side. So if you want to get some of that on your way out, please do.
Okay, thank you.
Yes,
Take care. Stay
okay.
safe.
Okay,
Right.
stay safe.
9:50. We're going to close.